Hey guys, welcome to Vet Ranch. I'm Dr. Karri. I wanted to let you meet who we're calling Pico, the little guy, and Gallo. They were both actually just left on the doorstep of our local shelter, and they're pretty old. Obviously, Pico's quite a bit older than Gallo, and their teeth are horrendous, like the worst dental disease maybe I've ever seen. Come on, Pico. They're actually really sweet. They're just really scared. It's okay. I know. You're okay. So this is little Pico man. I mean, tell he's older. Look at his nails. Can you see that? It's totally just grown out. Haven't been trimmed. I don't even know how long. And then, you know, he's got some eye issues, like some cataract starting. Looks like a pretty bad ear infection in both ears. And then his teeth, see the way he's kind of holding his mouth open like that? His teeth are so bad. I'm gonna wait to show you until he's under anesthesia because they really do not like, let me try to show you this. Do not like when I mess with their mouth because it hurts them so bad. And you can tell his face is really swollen right here, swelling from kind of an abscess or infection. So we're gonna get some blood work on them and heartworm test them, make sure they're healthy, listen to their hearts and examine them, and then they're going to get a major mouth makeover. So a little scared, but they're really, really sweet. Come on, go in there. Oh goodness. So, I know. So he's a little bit younger. I would say he's probably several years younger than his brother. And he's not neutered, so we're going to also neuter him. But his teeth are also terrible. You can kind of see there, and I'll show you more when he's out. We have our little Gallo man. He actually did have a heart murmur, so we're monitoring him very closely and trying to get through this neuter and dental really quick. But check out these teeth. Oh my gosh, they're just like, I mean, barely hanging on there. They're just all tartar. And then these bottom ones are just basically gone. I don't know what's on there, if that's hair or some kind of fabric. It's really bad. I want to show you his teeth when we're done. He actually got to keep more than I thought he would. He lost this bottom canine and then all of these top incisors, but better than I thought. We have our little Pico under now. As you can see, look at his ears. I'm going to glance in there. I think he's got a pretty bad ear mite infestation, which means we should probably treat the other one as well because that kind of gets on the bedding and everything. Yeah, they're everywhere. It's gross. So there's mites crawling all in there. So we're going to clean out his ears and treat those ear mites, treat the secondary infection. But check out these teeth. I mean, you can't even see a teeth. They're just this giant sheet of tartar. He already has a pathological fracture. So right here when you go like this, his jaw is actually broken because that bacteria has gone into the bone and just dissolved it and eaten away at the bone. So we just have to be really careful with him. It's just going to be kind of slowly getting through this and seeing what we can find. Oh my gosh, it's so gross. I just wanted to show you his actual teeth. Once we get all that tartar broken off, you know, that was just a complete sheet of bacteria and tartar. So his teeth are actually really tiny in there. And they don't look that horrible. So these bottom ones, I'm really worried about his jaw, but it's not too bad. We had to remove this tooth on the other side because it just wasn't even held in by any bone anymore because this bacteria has just eaten away at all the bone. We're waiting for our little tiny Pico to wake up. I went ahead and kind of just made a little secure kind of tie, I guess, to stabilize this mandibular fracture. It may never grow back together, but maybe if we get the infection under control, it will. And it should hopefully make him a little bit more comfortable too. And overall his teeth kind of look okay. I mean, now they look good. We got all the infection out of there. So he's probably gonna have to have one more procedure to kind of evaluate this jaw and remove that suture. But so far so good. And we trimmed his nails because they were terrible. So we're just keeping him warm and waiting for this tiny guy to wake up.
Sometimes when you're feeling young and you're feeling tough and you're all caught up, but you don't walk right and you don't talk right and there ain't nothing wrong.
They're doing amazing in their foster home and really love the attention and love being spoiled. So they are ready to go to their forever homes and are now adoptable. And we just want to say thank you guys so much for your donations and allowing us to take these two little ones and help fix their dental problems and assess them and help make them adoptable. Thanks, guys.
Right, and there ain't nothing wrong with feeling strong, but I know what you're going through. I know, 'cause I've been there too. And I don't walk right and I don't talk right, and there ain't nothing wrong with feeling strong, but I wanna be there for you, honey, working my job and making